My patients will laugh and tell you that one of the biggest things I talk about is scar tissue and adhesions. But it's so important as to why your body can't move and can't function properly. Your body can't tell a difference between scar tissue, which is bad, or adhesions that are bad, and normal healthy tissue. So if you're doing some sort of motion and it feels a pull, if your body feels a pulling on tissue, it will stop the motion or come up with a more compensatory movement to get you to where you need to go. This leads to breakdown. And so if we don't improve the mobility of those adhesions, if we don't get them moving so that the two areas can be separated, moving independently like they're designed to do, then it doesn't matter how many joint mobilizations I do or how much strengthening I do, it's not going to have the true effect that it needs to. If you don't have the mobility of your body because of these adhesions, then there's not going to be any motions of the joints. And so if you've had a surgery, there are surgical scars that we need to deal with. Also too, there can be adhesions. A lot of adhesions happen within your abdominal cavity because we don't move so much in through our abdominal cavity. And I always say it's like a glass of tea on a hot day. You put it down on a table, a lot of condensation around there, like there's a lot of liquid in the abdominal cavity. If you leave it there for a long time, you don't move it, the condensation eventually kind of dries and it gets stuck there. And that's the same thing that happens with your organs within the abdominal cavity. We don't do a lot of motions to kind of elongate through there. And so there can be adherences of your visceral organs inside the abdominal cavity because of this. So to really affect the mobility of the body, we need to break up these adhesions. We need to get in there with our hands and kind of go in between the lines of where the muscle should be or where the organs and muscles should be and make sure that they are separated the way they're supposed to be rather than connected because of these adhesions. It's only then that we can really work on the joints and then do exercises to stabilize that will have a lasting effect. Otherwise, we're just fighting against these adhesions that will then eventually actually rotate the bones out of place again just because of that abnormal pull. The body can't tell the difference, but the pressure that we're applying with our hands when we're treating isn't enough to break up healthy tissue. It's just enough to break up the unhealthy tissue, those adhesions, that scar tissue that shouldn't be there, to free up your motion.